Welcome to Unit 2 Psychological Models of Abnormality, Session 12 Psychodynamic Model of Abnormality. We will be continuing with the same model. So far, we have discussed the meaning of psychodynamic model of abnormality, levels of consciousness, structure and dynamics of personality, psychosexual stages of development, and ego defense mechanisms. Learning objectives: to understand the impact of the psychodynamic model, to understand and evaluate the psychodynamic model. Session outcomes: knowledge about the impact and the evaluation of the psychodynamic model of abnormality. Let us now discuss the merits and demerits of the psychodynamic model of abnormality. The psychodynamic model of abnormality has some merits. Firstly, this is perhaps the most systematic explanation or the first most systematic explanation of the cause of normality or abnormality. And two important noteworthy contribution of Freud is his therapeutic techniques of free association and dream analysis, which were extensively used to treat various kinds of psychological disorders. Next slide. Continuing with the merits of the psychodynamic view or perspective of abnormality, it is also important to understand that Freud has given importance to the unconscious, role of unconscious in determining behavior, as well as the ego defense mechanisms in reducing anxiety. Freud also emphasizes the role of early childhood experiences in determining normal or abnormal behavior. Overall, Freud's theory is the first most systematic theory to explain normality or abnormality, wherein they've explained the role of unconscious, ego defense mechanisms, as well as the psychological or psychoanalytical therapeutic techniques. Now let's move on to some of the limitations or the demerits of the same model. Firstly, though it was systematic, psychodynamic model given by Freud lacks that scientific temper. It does not have the empirical or experimental evidence to support its basic assumptions. The effectiveness of psychoanalytic therapy is not experimentally substantiated, or it is not supported by empirical evidences. The next slide. It has overemphasized the sex drive. Rather, Freud has given too much importance to the sex drive, and it also gives a very pessimistic view of human nature. At the same time, Freud does not give importance to the optimistic side or the brighter side of life, such as motive towards personal growth and development. To summarize, when we talk about the impact of psychodynamic model of abnormality, there are a few merits of this model, that it is the first most systematic model, role of unconscious, importance of early childhood experiences, etc. are emphasized. At the same time, it has a few limitations as well. Overemphasis on the sex drive and not giving importance to the brighter side, such as motive towards personal growth and development. It does not have scientific temper, or it is not supported by empirical and experimental evidences. Thank you.